We had a genetic counselor student several years ago who did a project with us, and her goal was to see if she could identify late-onset Pompe patients using Icd-10 codes. And when she did just one Icd-10 code for limb-girdle muscle weakness, she was able to find 2 affected patients, even with very low pickup and access for those particular patients. And then one of them had a sibling. So her yield was really good. And over the years, we've wanted to try that again. But things have changed. Our Icd-9 codes are now gone, and now we've got Icd-10 codes. So we had to figure out if maybe we could develop a severity scoring system that we could look for specific Icd-10 or structured data within the Emory medical record system and figure out if maybe we could use that piece of information in the scoring system to find patients at risk for late-onset Pompe disease. So it's interesting, and it's not a study that, it's been done a few times, but what's different about this time is we're really trying to put together a scoring system that we can then validate and then be used more broadly. In this case, it was not automated. It was very much a hand-scored system. And our other goal with this study was to raise the educational information out there for our neurologists so that they understood if they saw this limb-girdle weakness, that maybe they shouldn't just think about some common things. They should think about Pompe as well because of the treatable condition. So what we did is we went through and we had them look for the Icd-10 codes and the Icd-9 codes. Then we hand scored through those to see who's at increased risk based on what we saw. One of the problems we noticed is with the Icd-10 scoring system, Duchenne muscular dystrophy and other muscular dystrophies are all lumped with Pompe if you're looking for just a certain code that's for muscular dystrophy. So that was one of our first challenges. But we found that with some going through things, being very patient, and adding in the liver function test, we could figure out who's undiagnosed, has limb-girdle muscle weakness, and then when they're scoring, it looks like they'd be at increased risk. So from the educational side of things, we did have one patient who was diagnosed with Pompe disease. However, she was not within our data set. She was after our data cut, but we consider that a victory of our educational and what we've been doing for all of our doctors. In the meantime, our work still continues with going through and reaching all those patients. Because we're doing this at an academic center, we must first get the permission of the physician to contact the patient and then contact the patient after there. So it's a process that takes a little bit longer than we expected, particularly with COVID being dumped in the middle of our study. So we have persevered and figured it out, and I think we will have great news next year as well.